for vomiting. And on this visit, they found out that there was a large posterior fossa tumor. And because I was like the general population as a third-year medical student, I was horrified. How could a doctor ever miss a brain tumor? Because it's a brain tumor. This is a big thing. And he sat down and he said, well, you know, some things, particularly childhood cancer, it's really not clear what it is until the children are very far advanced. And that terrified me, because then how would you know? And he said, any child that comes in that has repetitive vomiting without fever, you have to consider a brain tumor. Now, that doesn't mean you have to CAT scan all of them, but you have to do a detailed exam and consider it and think about it and give advice to the family. So when my daughter had this vomiting, this was playing in my head. And I did take her to the hospital. She had an MRI, and there was a huge posterior fossa tumor. And I was devastated. I thought that I had been in trying to make my name in academic emergency medicine. I was young. I was doing a lot of hours. I wasn't at home. I must have been a terrible mom, because if I was a better mom, I would have had to have seen the signs. And then I thought, well, maybe I'm a terrible, terrible doctor. Like, how did I miss this in my child? If I can't see it in my child that I see every day, how am I going to know what's wrong with a patient that I see for 15, 20 minutes? And can I live with that maybe some of the people that I'm sending out, I don't know what's wrong with them? Can I ever be a physician? And I'm the sole income earner for my family. So if I'm not a physician, how are we going to survive? And I was just overwhelmed. My family was looking at me to be the one to help navigate the medical system. This was a big deal thing, understanding chemotherapy and radiation and the surgery. And I found I knew nothing about pediatric brain tumors. I knew nothing about radiation. And so I then felt incompetent for my family. I might not be able to provide for them financially. I wasn't able to provide for them with the information that they wanted and the comfort of how to navigate the medical system, because it is all different on the other side of the stethoscope. And as I went along, I became more entrenched with these thoughts. And I started thinking, if there was a merciful God, I would not wake up this morning, but I did. And I started saying that. And by this time, I had been off work 2 months while she was in the hospital the entire time. Reason for that, I missed this part of the story. When she came out of surgery, she came out completely neurologically devastated. She was blind, mute, paralyzed, incontinent, unable to do anything that a normal 5-year-old could do except think and hear like a normal 5-year-old. So she couldn't tell me what was scaring her. I didn't know if I was talking to her, whether she was reassured. I didn't know what she wanted. And I was the one who consented to this surgery. And for me, I did this to her. I did not look for a second opinion. I did not even know where to go for a second opinion. I didn't look at any other choices besides surgery. And I felt that it was my fault and my responsibility that all of this happened, because I was the one with the medical knowledge. You can't blame it on anybody else. And clearly this wasn't a good outcome. Somebody has to take the fall for this. And that is when I started walking down that path. And the longer she was in the hospital and the harder it was in getting better and being unsure how our dream life that we thought we were going to have, all changed. Her friends didn't come to the hospital. We didn't have play groups. Clearly, going to college was not in her future. And it seemed to all fall apart. But nobody stopped me at if there's a merciful God. And as I went along, I started saying, if there wasn't there's nothing going on today that 100 units of insulin wouldn't cure.
Which is translation for...
Which means that is a lot of insulin for somebody who is not diabetic, and the intent would be to kill yourself. You would people sometimes use codes. They don't say exactly, I'm thinking of killing myself, but they send signals. A lot of times people will send signals. And could it be some black humor and stuff like that? Well, if the circumstances are bad and somebody's saying this, even if the circumstances aren't bad and you don't know, you can always ask. The interesting thing was nobody asked. I could see the deer in the headlights, absolute horror at what the next thing you do. And this would be the greeting. You're like, hi, how you doing? Nothing going on today, the 100 units of insulin won't cure. And we would do this intermittently, day after day with different people, and it never went anywhere. Because I think that they didn't know what to say. And the message I took away was, you don't want to go down this path. You really, really don't want to go down this path. Because if you go down this path, bad things will happen. Nobody said what it was, but I just could see it in their eyes, that I will have to 302 you, involuntary commitment, or you won't be able to work, or they may take your child away from you. Like, the numbers of bad things that could happen just became exponentially larger as people didn't respond to it. And I decided, well, they are telling me, if you say this, bad things are going to happen, and maybe you won't be a doctor, and you won't be part of us anymore.
It's really easy to see how people who have conflated self with identity, self identity with job, could get into a very tough predicament where if they don't have the job, yours was doctor, it wouldn't matter if you're alive, right? Because that is who you are. And without that, you're nothing. So you might as well be dead if you're going to be nothing. And what I'm hearing through your story is you lost multiple identities. You lost the identity of what you had dreamed for your future. You lost the identity of quote unquote good mother. You lost the identity of quote unquote good doctor. All the things that you aspired to tackle are now, thrown into question. And there's a sense of not only frustration and hopelessness, but also an incredible amount of guilt and shame that seems irreconcilable at that point. So if you're listening to this and you're hearing Lois's story, obviously she's alive and well now, and she's, resolved issues because she's doing great things in advocacy and so forth. And that was 20 years ago. But if you're hearing this and you're hearing her story and you go, holy cow, that sounds like and then you fill that blank in with, brother, friend, next door neighbor, spouse, ex, whoever it is that continually talks in those terms, that is more likely than not an invitation to ask, hey, what is there I can do to help? Because that is pretty dark. I mean, if you're not used to the person being dark humored, which, we could have a debate about whether or not that's appropriate in and of itself. And this seems authentically dark rather than just humorously dark. It's probably an invitation to talk. And what I'm hearing is that these people just didn't want to talk. They themselves didn't know what to do. They didn't have resources. It wasn't a common conversation to have among your peer group.
Yeah. These are people that I know loved and cared about me, I've worked with for a long time, and I really think that they didn't want to make things worse for me and didn't know what to say where they could be assured that the consequences wouldn't be horrible. And so, since nothing bad happened the day before or the week before, it's like, okay, well, I guess it's okay, and I guess that's the way she is, and it's a really hard time, and that's the way she talks, and we're still doing okay. And I think we don't teach each other how to deal with these conversations. When you were talking about the multiple losses, I wrote a story, but it was about the loss of my dream child. And when you have a child and you see them as a baby. You think they could be anything. They could be president, or they could be a ballerina, or they could cure cancer, like 1,000 different things. The potential is just overwhelming. And as you go along, you might realize, well, they're never going to be a singer when you hear them sing happy birthday. Or, yeah, that just really didn't go well when they threw the football. But on other times, you'll say, gee, they're an amazing reader or an incredible thing. And you get this chance to learn the strengths and how to support the weaknesses of your child. And in one day, I went from all those potentials to the loss of my dream child. And the platitudes, well, she's still with us. No, my dream child was not still with me. My daughter was still there. But I grieved the loss of my husband, and I both went to college locally here in Pennsylvania, and we would have this teasing battle back and forth, which college she would choose. After she had her brain tumor and her surgery, we never talked about that again. That died when she went into surgery.
Wow.
And so people want you to feel better. They want to give you the positive things. And it's hard to talk and stay present to the darkness. So for me, I just walked right down that suicide pathway, completely unimpeded. And although it was sort of stressful and scary, on the other side, it was great. I loved it. My life was out of control. And so for this period of my day, when I thought about it, I was in control. I might not be in control of a lot of things, but I can at least be in control of whether I'm going to live or die today. I have that one thing left. And then as I started, I'm like, I have choices that I'm in control of. I can choose the time, and I can choose the location, and I can make decisions of, this is not going to happen in the hospital because they have B50 glucose sugar that will bring you back. So I have to figure out a place where I'm not going to be found. And then I can start thinking of different places and how far I want to go. Like, there are lots of things that you can have choices about. And having more choices made me feel in control of my life when I wasn't before. So I now have been, when I've talked about this to other people, somebody told me that I needed a 12-step program. I'm like, never thought of it before, but I absolutely needed a 12-step program. This was, thinking about suicide was like my drug. It made me feel better, and it made me feel more in control. And I think maybe in some ways, if you weren't comfortable talking about it and trying to alter the course, I'm not sure how much I wanted to talk about that aspect. I think people would think that that's weird, that's crazy. What? You are crazy. Not that those thoughts are crazy. You yourself are out of your mind.
What, looking back now, what would you have said if somebody actually confronted you and said, man, you've been talking about this a lot. That sounds like it might be a problem. Like, were you aware that it was a problem?
Oh yeah. I was aware that it was
fully
a problem.
aware. Okay.
Oh yeah. I mean, I was aware it was a problem, but I also was unable to stop it.
Interesting. So these days, what we teach in, suicide prevention is, a lot of validation. But I'm wondering if that would have even worked. If somebody goes, man, yeah, you are really going through it right now. Like, would that have even worked if somebody had just simply had some validating things to say? Not the platitudes, because the platitudes fall short. Those are intellectual. They're cerebral. They hit the frontal lobe. And if you're full of emotion, it's just simply not going to hit the right part of the brain. But if they validated your sadness, if they validated your guilt, you think that would have worked, or would you have brushed it off?
No, I do think that it would have worked, because I do think that what people want at their darkest times is two things. They want to really be heard, and they don't want to be alone.
Mm-hmm.
And if you can assure somebody that I will sit with you, I can listen to this,